Hello, everybody, and welcome to our first evening talk webinar style. I'm super excited to have you all joining us today because one of my newest favorite people is going to be speaking today, Dr. Sierra Storm. And you probably see that Hillary Beckwith is on as well. And Hillary was kind enough to make the introduction, introduce me to Dr. Storm, and I got to meet her just before the summer. Um, and it was probably one of the most fun, like, provider meetings I've had in a really, really, really long time. Just a lot of powerful women getting together and talking about where they were headed in their practice, in their business, and personal. And it was lovely and lovely. And so when I met Dr. Storm, I said, "Oh my gosh, you have to come and speak. Other people need to know you and meet you and get, benefit from your energy." And so she agreed, which is great. So I'm super happy.
So
And so, huh?
thank you. So
You're
honored to
so
be here. And it was such a delight having you at that meeting. It was just, you fit right in. It was just good all around. Thanks for
It was
coming.
so lovely. Thank you. Thank you. And so when Dr. Storm and I started talking, um, we had talked about a few different options for what she could come and speak to us about. And we started with this one, PRP. PRP is something that we do have a good number of our patients go through treatment for, but as Dr. Storm will kind of talk about, it's a little different when you do this with a naturopathic doctor versus sort of a traditional Western medicine approach. And because of that, I said, "Oh, I definitely want you to come and talk." So just a little bit of housekeeping. Everybody is muted. Um, Dr. Storm will go ahead and do her presentation. At the end, we will open it up for questions. Now, if you have a question that you want to ask that is maybe a little bit more personal and more private, then let us know in the chat and we will turn off the recording so that you can ask your question. But otherwise, just know that the recording is on and we are going to then put this out just like all of our other videos. They'll go out into the YouTube channel and share it with our list so that everybody who isn't here today but is interested in this information will get to have that opportunity. Um, quick introduction. So I'm Dr. Hickman. I'm the owner, CEO of Pain Science Physical Therapy. And you guys have, those who are joining us today, you are learning all about who we are as a company. And one of the things that we like to do is bring in providers to talk about topics that are of interest to us as providers, but also to our patient population. And so I'm going to stop talking and I'm going to let Dr. Sierra Storm go ahead and introduce herself and the topic that she's talking about this evening.
Oh, well, thank you again so much for having me. PRP is something I've been doing for 10 years now with patients. It's really, really close to my heart. I think it is a phenomenal therapy, and I'm really honored to get to be here and chat all about it. My name is Dr. Sierra Storm. I'm a naturopathic physician. I practice in Lower Queen Anne in Seattle. A little bit of my background. When I was just starting practice as a naturopathic doctor, I came into the field in women's health and pediatrics. Right as I was starting my practice, I got into a pretty significant mountain biking accident. And that caused my shoulder to separate from my collarbone, had major fractures in my arm. And I was just starting this practice. My partner was far away and couldn't kind of help me take care of myself at this time. And I didn't want to undergo surgery. And I had just graduated with this more functional degree. And I was like, there's got to be something else besides surgery. They wanted to put metal in my body. And I'd had patients kind of in clinic that had reactions to metal. I didn't want to go under general anesthesia. I was looking for any option that would allow me to heal this more naturally. And I found a regenerative medicine injection doctor in Bellevue. I went to see him a couple of times. Within a very short amount of time, my injury was healed. I was able to use my arm again without surgery. I have full range of motion and full strength. And I was like, I have to learn how to do this. So I just started studying everywhere. I studied, I practiced, I preceptored, and then I interned. I've volunteered in Mexico and in Canada. I've done a lot with this injection therapy, and it dramatically changed my life and my practice. So again, very honored to be here chatting about PRP and also how to use it in a functional naturopathic perspective rather than just a one and done treatment like is mostly done in more of the Western perspective medicine. So I've kind of talked a little bit about why I love PRP, but it's very dear to my heart from my own recovery story. I've also been treating my aging parents with this therapy, and it's been really incredible to watch it allow them to keep their strength, mobility, agility. My dad is still skiing in the backcountry and doing like cat skiing out in the woods at 70. We've treated many ski injuries for him, many sports injuries for him. And I've treated all of my family members. It's really lovely to be able to provide this service and to watch it help the people I love just stay healthy and strong. So that's a big part of why it's important to my heart. I also think that there is a lot of misinformation about PRP and that it's not quite used in a way that makes it as effective as it could be. And so I'm really excited to kind of talk about how we make the most out of this therapy, how we get the most out of this therapy, how do we prepare our body to have a really easy treatment, to not have much of a flare in pain after treatment, and to recover as well as possible. So sort of basics of PRP therapy, what this is taking your body's own healing cells called platelets. We then draw blood, we spin out those platelets in a very special centrifuge. It concentrates them really significantly, and then we drop that concentrated healing cells, and we can inject it into places that have had damage or degeneration. So primarily in joint tissue, but also we can use this for skin and for hair regrowth. What it looks like in an office treatment is basically you come in for a blood draw, we spin in office, about 15 minutes later, we will inject that into any areas that's been shown damage on an MRI or recent imaging, or where you're having pain. And then over a 4 to 8 week period, those platelets go to work and lay down new tissue and basically repair and heal things from the inside out. So it's a pretty easy and actually much more comfortable treatment than most people expect. And there's not a lot of downtime, which I also really, really love. Why does this treatment work? So I like to talk about PRP from the angle of like, if you experience a cut, because we've all had a cut and we all have kind of realized and know that our body is capable of healing that cut completely, and we just get on with it without much intervention from us. So if you get a cut at your skin, your platelets, those healing clotting cells, sort of rush to the skin surface. They start to create a clot. But platelets do a lot more than clotting. In fact, they release these little cellular signaling messengers that are called growth factors. And as those growth factors, there's lots of different kinds, interact with the tissue around, they start to cause cellular replication. They make new blood vessels that can kind of reach the area. They strengthen and mature the cells in that area, and they basically create this whole healing environment. Your body takes it all the way through, the cut heals, and maybe you have a teeny tiny scar at the top, but otherwise you kind of can't tell that anything had gone wrong. We do something very similar when we concentrate these platelets and then inject them into areas of damage. Basically, what we're doing is restarting that healing cascade from scratch from the bottom. So if your body has only recovered so much, or you're still in that active healing phase, we basically reboost that and then take you all the way through it. So there are lots of different growth factors that end up being released. There's platelet-derived growth factor that is responsible for cellular replication, so it causes those cells to divide and proliferate so that you have more healthy cells. We've got the TGFB, so transforming growth factor. That one's really important for modulating the inflammation that's in the post part of having an injury. We have a specific growth factor called vascular growth factor that allows us to make those new blood cells. And then insulin-like growth factor causes more cellular healing and proliferation. So there's lots of different cell signalings that go into this process that basically give your body that full blueprint to get to healing. When we take that out of, okay, we've had this injury at the surface, we can see the cut healing, we can see the scab forming, and then it comes into a scar. When we take it into the joint space, there are extra benefits. So we see that synovial fluid viscosity improves. Synovial fluid is the fluid that kind of bathes the inside of a joint that provides that lubrication as your joints move around each other. So that's really, really important. We get all of this collagen stimulation. So we actually lay down new, stronger collagen fibers, which is really important for providing that scaffolding for like our collateral ligaments in the knee or any supportive joint ligaments that are giving structure and strength around those bones as they come together. We also note that this decreases what we call catabolic enzymes. So a lot of the reason that we have tissue damage is that there are enzymes in the area that are kind of eroding the tissue in that area and kind of degrading it. So we see that the action of those enzymes decreases after a PRP injection, which is pretty amazing. It also can stimulate chondrocytes. Chondrocytes are those cells that lay down new cartilage specifically. So we even can get some improvement in that cartilage layer at the top of those bony ends that buffers them from impact. So we see basically a restart of this entire healing cascade and process that begins from the beginning, sets up a much more healing environment, decreases damage in the area, lays down new tissue, and then provides us with a stronger joint at the end, which is just kind of an incredible thing. So that's sort of the background of the mechanism of it. So benefits of choosing PRP. So the way that I look at the benefits of this is what are we comparing it to? Right? Often when we have joint damage, injury, or degeneration, the options for healing this are cortisone injections, and we'll talk about the word healing in that context, or surgery. What sets PRP apart from cortisone is actually what we call a catabolic hormone. That is a hormone that causes tissue breakdown. We use it because it decreases that acute inflammation, which causes that pain signaling. But I compare this to almost cutting the wires of a fire alarm while the building burns down. Yes, we might not hear that agitating noise. We might not feel the agitation of the pain, but it actually is increasing the damage to that joint. There's a reason we can only use so many cortisone injections in a damaged, injured, or painful joint, because eventually we actually wear down that joint tissue and make the problem a lot worse. So compared to a cortisone injection, PRP can actually increase the pain for just a moment, 24 to 48 hours. We might feel a little extra aching because it is actually increasing that acute healing inflammation in the space. So it might agitate it for a moment, but then we actually start to repair that joint. We're getting to the root of the problem and progressing, so we have a stronger, more highly integral joint after the treatment. When compared to surgery, there are so many benefits. First of all, it's a very quick, painless, pretty darn safe procedure in office. It doesn't require general anesthesia, which comes with a host of risks. We don't damage the area more by slicing through many layers of tissue. We don't create scar that could actually gum up the works later. Significantly less downtime on the other side. We get to actually go out from that treatment and walk on our joint. We actually get to keep that mobility, that reliance on our muscles. We have much less muscle wasting. So we just create a much easier environment to heal from. So I think that's a really, really huge benefit. We also are using our own cells. So there's minimal reactivity. There's nothing synthetic going into our body. We do a little bit of lidocaine in the PRP formula, which just makes the procedure more comfortable. But generally speaking, this is a low risk of allergy, pretty darn gentle, using our own healing cells, which our body knows exactly what to do with. So that's really great. Like I said, minimal downtime. There's also minimal risk. There's a little bit of risk of infection in the joint if we're not using sterile technique, but we absolutely do. There's some risk of bruising, but compared to surgery and other interventions, it's a really low risk intervention, which is awesome. The other thing I really love about PRP that I think is a benefit is that it can be used both for repair as well as preventative damage. So we can actually treat joints preventatively if we have a history in our family of quote unquote bad knees or bad hips. If we're an athlete that's wanting to prolong our running or our sport of interest, we can actually do tune-ups. And I will do this for patients every 5-ish years, where we're just like, we want to take really good care of these joints. We want to make sure that we've got good cartilage base and that our ligaments and tendons are really strong, and we can just do tune-ups there. So I love that as well. There are a lot of different conditions that benefit from PRP. So in a shoulder joint, we can treat frozen shoulder or adhesive capsulitis. We can treat rotator cuff tendon tears. There is a kind of caveat. We don't treat any tears that are over 50% thickness. The platelets do need a scaffolding to lay down new connective tissue over. So if there's complete break of the tendon or ligament, we cannot actually repair that with PRP, and that does require surgery. It also doesn't fix severe arthritis. We get some improvement in that cartilage layer, but it's often not enough if it's actually down to bone on bone. But we can do a lot with rotator cuffs, labral tears of the shoulder, adhesive capsulitis. We can treat both tennis and golf elbow really well, any damage to the radial ligament as well. Carpal tunnel does really well with PRP treatment. So does arthritis if it's mild to moderate in the hands and fingers. We can treat hip labral tears as well, and also mild to moderate arthritis in the hips. We treat meniscus tears in the knee, medial and lateral collateral ligament damage, as well as ACL and PCL, again with the caveat that if the tear is more than 50% thickness, we're not going to be able to do as much with that. We treat plantar fasciitis, ankle sprains, ligament tears in the heel, Achilles tendonitis, and Achilles minor tears both really benefit from PRP as well. Morton's neuroma does really well with this as well. So PRP is a really good treatment for that. Yeah. So that's kind of a layout. The sort of general overview of that is any sort of collagen-based soft tissue tear responds really, really well. Additionally, we can repair muscle tears, so tears to the belly of the muscle with PRP. Basically what we're doing, again, your body has this innate intelligent blueprint of how to heal. If we just send in the cells and the signals that provide that blueprint, your body gets to work and does all the things it already innately knows how to do, which is really awesome. So common misconceptions. I have been hearing this more and more as PRP becomes sort of more prominent and more popular, which I'm loving that is happening. Because PRP is not covered by insurance, we get a lot of misconceptions about it not being studied, not having reliable research, and maybe not being all that effective. This treatment has been around a very long time. They were using it in maxillofacial surgeries back in the late 60s, and it's been used in dentistry since the late 90s. So this is not a new treatment. We have quite a bit of literature now and studies to show its improvement. It needs to be used in the correct circumstances to treat the right things, but it is quite efficacious. I think another piece that leads a little bit to PRP isn't as effective as I see it to be is that it's often said to be a one-time standalone treatment. If you don't get benefit from that one shot, it's not going to work for you. Don't even worry about it. Don't even kind of go down and consider more treatment. I don't find this to be the case. I see, generally speaking, somewhere between 15 and 30% improvement in pain and function per treatment that we do. And so I always consider PRP a series. Generally speaking, it's around, I recommend around 3 in 1 month sequences. So 1 each month for 3 months, kind of gradually repairing. Every human body is different. Some people need 1, some people need 4. So we kind of take this by case, but I rarely find this to be a just one and done treatment. So that's one thing that I think gives it kind of a bad rap is we're using it inappropriately. Second to that, most doctors who use this in more of a Western perspective will do just one injection. They will basically fill a joint space with PRP and then say, we're letting it go from there. I find it incredibly important not only to fill the joint space to help with the cartilage and where those bones come together, but to treat all of the surrounding ligaments and the capsule to help make sure that that is really sound. So part of what happens as bones sit on top of each other, they sit like this, and they have all these supporting ligaments and capsule tissue that allows it to be in good alignment. If we tear or partially tear one of our ligaments on this side, the bone collapses here and starts to rub. And that can cause more degeneration of that cartilage surface. If I treat the cartilage by flooding this joint capsule, and then also repair this ligament so that the bones sit more in alignment on each other, we actually get a lot more function, a lot more strength, and a lot more stability in that joint. So I think that's really important too. I often see just one injection. Generally, if I'm treating, let's say, a knee, doing between 5 and 7 injection points just to tighten up everything and make sure we have really good integrity in that joint space. The other thing that I hear a lot that I think is a little bit bogus is that the health of the body doesn't matter. Like PRP just either works or it doesn't. To that, I would say we're using your cells and we're putting them into an environment that might be very inflamed or not so inflamed. So if we're wanting to get the best out of this therapy, we have to make sure we have really good integrity in the health of the system. So we want your body to be as healthy as possible and be ready to receive that sort of set of blueprint instructions that your body then knows how to take away and create new tissue with. And that I look at this very naturopathically, very functionally, like, are your hormones working? There's a lot of stuff that I kind of take into account to say, are you a good candidate for this therapy? How do we get this therapy that you're going to be investing in to work the best that it possibly can? Another misconception I see is people will then get imaging afterward and say that because they can't see a substantial increase, let's say, in the cartilage thickness, even if their pain and dysfunction have totally resolved, that it didn't work. And I would say we might get a microscopic amount and it might make all that functional difference. So if your mobility and your range of motion and your strength and your pain have all improved, then that is a positive result. Then the last thing I'd say is it's really important to use this treatment in places where it shines. If you're trying to improve severe arthritis, this is not the treatment. It's not going to work the way we want it to. And so in that case, yeah, I don't think PRP is very effective and I wouldn't use it. Same thing if the tear thickness in a tendon or ligament is all the way through, we're just not going to get the result we want because we don't have that scaffolding held together. So we got to pick the right places to use it. But when we do, I just think it is one of the most incredible therapies. That's bringing to mind a thought from before. When we're comparing PRP to other treatments and kind of seeing what the benefits of it are. Another treatment that I compare this to is stem cells. A lot of people are opting to just go straight to stem cells and sort of skip over PRP. And this is an interesting place. Sometimes stem cells knock it out of the park. Sometimes you can do one and done, and it just really works. This treatment is it's almost 10 times more expensive often than what a PRP treatment is. And because of that cost kind of benefit analysis there, we often can only do stem cells one time. And it often isn't a standalone treatment again. It still often requires multiple treatments. So it just becomes cost prohibitive in a way that doesn't allow you to have those multiple inputs of that repair sequence coming in. So generally speaking, I actually don't recommend that people go straight to stem cell. I recommend doing a series of PRP first and seeing how you do. Most people will get more benefit from a series of PRP than they will get from stem cells, from my experience over the last decade. So then kind of what are we looking at when we're looking at whole body health? How do we allow our body to be best prepared for receiving a PRP treatment? There are a couple of things that I screen for to make sure that people are really good candidates. The biggest components are hormone balance and inflammatory levels. So there are a lot of hormones in our body that go into tissue repair and help modulate and mediate it. They impact it. One that is not considered very much is thyroid hormone. Our thyroid hormone actually helps regulate bony cell replication and growth, as well as soft tissue and muscle cell differentiation. So it's really important to have optimal thyroid function to allow your body to heal. It's sort of like dropping off, like if we just drop off instructions to a construction site, but there's no crew, there's just going to be this paper saying this is what should have happened, but we can't execute in that same way. So it's really important to have like the rest of the crew on board. Cortisol and cortisone are both made by our adrenal glands in our body. These are stress mediating hormones, and they are similar to a cortisone injection. They can be what we call catabolic. They can increase tissue degradation and injury. So if our stress hormones are chronically very, very high, we actually aren't going to get the same benefit from PRP that we could. So making sure that our cortisone is, I actually will test this in office. I'll test the cortisone curve and sort of see if your body is overproducing, because that might blunt the impact of doing a PRP treatment. And then our reproductive hormones are so, so important. If you consider the tissue growth that happens through puberty, it is massive. Those hormones really modulate cell turnover, cell proliferation, and tissue growth. So those are all really, really important as well. I find that adhesive capsulitis or frozen shoulder is about 50% related to hormones. It's something that mostly women will go through, often in their 40s as their hormones shift. And we will actually use hormone therapy first before I even consider going ahead and treating that joint, because it just makes such a massive difference. Often that shoulder will loosen up without me even needling it, because those hormones have been restored and it helps that tissue heal. So really important to kind of be considering that. The other side of this is inflammation. Acute inflammation leads to healing. Chronic sustained inflammation actually degrades tissue. So we want to be looking at the sources in our body of inflammation. There are a lot of things that go into this. One of the places we have the most control is over dietary inflammation. So I work a lot with patients specifically testing for food sensitivities, because if we're eating foods that chronically inflame us, I actually sort of call this the lemon juice effect. Let's say the injury itself, the area of damage, is a paper cut. If we pour water over that paper cut, we're not going to feel it too much. If we pour lemon juice down the arm and there's a paper cut there, we're going to be through the roof, right? So sometimes 30% of that pain signaling is actually coming from the lemon juice of our reactivity to a food sensitivity being poured in an area that actually truly is damaged. When we take out the inflammatory foods, I'll often find that the pain will decrease, again, without even having to inject. So I'm always looking at like, what's our diet like? What's our hormones like? How are we all putting this together so we can get the absolute best repair and improvement across the board? So that's kind of like preparing the system to have its best effect. There are a couple things I've noticed that will still stand in the way of getting the most out of a PRP treatment. The most insidious one is scar tissue in and around the area that we're treating. So let's say a patient has had a ski injury, they damaged their meniscus, they had it surgically repaired 10 years ago, and then over time, they're doing their running, they're starting to notice more pain in the joint. That might be from leftover scar tissue that is actually gumming up that joint and not allowing it to move in proper alignment. We can actually change the whole dynamic of how that knee moves. So before I jump to let's treat with PRP, I will actually release the scar tissue through some scar injection therapy treatments and then allow that to come apart, and often knee pain will get way better. I actually came across this. I was at a seminar in Idaho like 8 or 9 years ago talking about PRP and stem cells actually. And the instructor on this one-off comment said, if you ever notice that someone is not improving the way you thought they would, go back and ask them if they've ever had a surgery on their body, treat their scar, and then see what happens. And so I started screening people for previous surgeries first, treating their scars. And often I wouldn't even need to then reach for PRP. It was enough to kind of remove this physical block, and their whole joint pain picture would dramatically change. So that's something that I find can kind of gum up the works. Another thing that can happen, let's say we have an injury that creates an issue with the ligaments that hold together the knee. Ligaments are supposed to hold bones together, and muscles are supposed to move them. When we have damage to ligaments as they're holding the bones together, they become weak. They can't do that very well. They can't hold good integrity. Our muscles kind of form this backup and end up tightening up around the joint to help it protect itself. And so what we can get is this sort of overuse muscle strain pattern that happens around the joint because the ligaments are not in good integrity. I find that even when I repair the ligamentous integrity around that joint, sometimes the muscles have this echo of this overuse pattern that's perpetuated for years. And so they'll still stay tight and you'll still kind of get this pain syndrome. So I will refer PT, massage, acupuncture. How do we get those muscles to kind of release their sort of stored tension story so that everything can work a little bit better around that joint? So that's most of what I have for you guys today. Always after we are doing PRP, I recommend PT because not only, so once we strengthen that joint, we need to know how to move muscles in a way that actually won't re-injure us. We need to get back in proper alignment. We have to get our movement patterns restored. So PRP is part of it, but we still do need to do that recovery that allows our body to move with good strength and in good alignment again. And that's kind of what I have for you guys today. So very open to questions. Ready for you.
Wow. Okay. So first of all, can you guys hear me okay? I want to say super duper thank you. Because the whole time I'm like taking furious notes and I would write a question and then you would answer it. And I'd write another question and then you'd answer it. So that was
Oh, I'm so
great.
glad. Great. That's
I
ideal.
yeah, so everything like, right? So just all these questions about, okay, imaging, and also what will happen. So, so my one question that wasn't answered, although I have lots and lots of thoughts, one question that wasn't answered is, we hear a lot, we have a lot of patients who come in and they're told by different providers that they can do PRP and or prolotherapy.
Yeah.
And I don't know if that's something that you're familiar with enough to be able to say what's the difference between those, because I think that's really helpful.
Yeah, I do both in my practice. So what I would kind of say to sort of compare these two, prolotherapy, distinct from PRP. In prolotherapy, we actually do a very similar needle technique. It's just that what is in the syringe is different. Most prolotherapy uses 25% dextrose plus some lidocaine for numbing and comfort in treatment to stimulate a very similar repair process. The only detriment there, and it's not really a detriment, I will often use this in very, very recent injuries where we just need to like help with a sprain. We don't need to like bring in all the big guns with PRP. But basically what that does is the dextrose nourishes these cells called fibroblasts specifically and gives them the fuel to go and repair. What you don't get is all that growth factor signaling, which really tells your body to stimulate all this cellular proliferation, those new blood vessels, helps with the synovial fluid, all those pieces. So you basically get, let's call it like the lumber gets dropped off to the construction site with prolotherapy, but you don't have like the architect and the construction crew. Does that sort of make sense? I'll use it
Yeah.
for with less damage that are more recent. And sometimes if people are like worried about cost, because PRP is about double as expensive as prolotherapy, we'll use that first just to see if we can clear it up like for a little bit more cost-effective treatment. And if not, and we need to increase to PRP from there, we can. But they're very similar. The injection technique, at least in our practice, is exactly the same. I'd still do 5 to 7 points in a knee, let's say.
Yeah, no, that was great. I appreciate knowing the difference for sure because that'll help me when I'm educating patients when they're coming to me asking me questions about this. I also think it's really important to know the limitations of any procedure that we as providers make recommendations for. I love I love that you address the component of the fact that people can get huge improvements in function and pain and be like, but the image is still showing the same thing, right? So that's so much of what we are working with patients on to be able to say, the pain process is an incredibly complex, it's a complex thing that's occurring in the body. And if you can do something one of the side effects of the treatments that you're doing that's really positive is that because there's a decrease in inflammation and an increase in these growth factors and laying down of healthy cells, we also calm the nerves down in those regions. So they're
Absolutely.
not like, right? They're not screaming back up to the brain going, danger, danger, there's all this bad stuff happening when they're really, right? It's not that bad anymore, but the system is, yeah. So I love that it's another way to interrupt the signaling between the nerves and the brain and start to change what the brain programming is around that pain experience. So
So
that's
well said.
fabulous.
So well
Yeah.
said.
No,
The other thing I'll say about imaging is complex, and a lot of times what comes back on an image is not actually the pain generator. So
yeah.
we may have fixed the pain generator, but you still might notice this micro tear over here, and that just wasn't causing the dysfunction we thought it was. So that part might not show a dramatic increase, but we actually got to the root of what was signaling your brain, as you're saying.
Yeah.
Yeah.
Yeah, absolutely. And then of course the other piece, like we know from imaging studies that we can find lots of wild and wacky
Yep.
changes that have no pain at all, right?
People
So
won't even know they have them. Yeah.
won't even know they have it. And then,
Yep.
and I do want to say, as a previous frozen shoulder, well, this is the shoulder, that it is full blown. It is, we call it the 40-year-old female
For you.
shoulder for a reason, right? It's very, very hormone related.
Yeah.
And one of the first things I'll typically talk to my patients about is, have you had your hormones checked? Just
I
to,
love that so much. Yeah.
so,
Super
yeah.
important. We always want to get at the
Yeah.
cause, right?
Yeah. Yeah.
Yeah.
And that's right. And that's the other thing that I think was really great about what how you're taking the approach with this is that you are trying to, and I mean, it's completely because of your naturopathic background, you're looking at it as, okay, is this environment the best possible environment for this treatment to now work as optimally as it possibly can?
Absolutely. It's critical. Yeah.
Yeah.
It absolutely is. Yeah.
So I'm super appreciative of
Oh, thank you.
all of that. That was really helpful, and I think we'll open it up. I don't know if there's anybody who has put any questions in the chat, or if anybody wants to unmute and ask questions. Just as a reminder, we are recording right now. So if you have a question that you want to ask that's maybe a little bit more personal, and you don't want it to go out into the interspace, then you can say so when you unmute or put it in the chat, and Jel will stop the recording so that it is not put out there. No questions? Come on, I can't have been the only one.
Oh, similar to you, I had questions that she answered already. So I'm out
I'm
of questions. Sorry. Thanks
That's
for
That's
great.
that.
Love it.
Yeah.
it's
So
so
thorough.
great. You've done this before, clearly.
I do it every day to some extent. We're always
Yeah.
having these conversations, which just makes us feel like a conversation, right? We're talking to patients about this
Yeah.
all day long. Yeah.
It's true. It's true. Okay. Well, if nobody has anything to ask, we're gonna end. Okay. Well, I'm gonna let it go, and nobody will feel the pressure that they need to pop on and ask a question.
Raise a
But
hand.
I
Love it.
want to say thank you so much, Dr. Sierra Storm, for being here tonight and sharing all of this really, really juicy, good information. And I know that was like I said, for both me and Hillary, it answered all the questions. So we really appreciate that.
Oh,
Um,
thank you. I'm so grateful. Thank you so much for the opportunity. I love talking about this so much. So thanks for letting me geek out for this
Well,
evening. I
and now I'm
appreciate
going to
that.
put a plug in to have you come back at some point and talk to us about scar treatment.
My gosh, that's my other favorite. I would be delighted.
That will be fantastic. So everybody say, stay tuned. There will be another opportunity to have Dr. Storm come back and talk to us, and we'll schedule that for, it'll probably have to be for the new year, but we'll
Love
definitely
it.
get you back.
Amen.
Thank
Okay.
you
Thanks
so
again.
much.
This was a delight and great to see you.